Welcome to Mom and Mind, a podcast about maternal mental health, from conception to pregnancy and postpartum. Real stories from moms and family members who have made it from struggling to wellness, and interviews with experts and advocates who work for moms and families to get the help they need. We discuss very real struggles that can sometimes be hard to hear, but these are stories that need to be told so that moms and families can know that healing is possible. This podcast is meant to offer information and awareness and is not a replacement for treatment by a professional. Thank you for being with us today. This episode touches on topics that may be sensitive for some listeners. Welcome to Mom and Mind. I'm your host, Dr. Kat. I'm very, very excited today. We have Amy Korn with us to talk about her story and her experience during her postpartum period. Amy is a mother of two and survivor of postpartum depression, anxiety, OCD, and PTSD. She is also actively working as a volunteer and advocate for maternal mental health in her community north of the Atlanta, Georgia area. She's been working with her pediatrician to develop a postpartum assessment program where all mothers with children 12 months and younger will be assessed at each well visit. She also just organized a workshop where 18 therapists received training specifically in postpartum mood and anxiety disorders. Wow, Amy, that's amazing. Thank you so much for being here and sharing your story with us today. For all of you listeners, sharing a story is one of the most powerful ways to help other moms and to let them know that they're not alone. And hopefully the moms who are listening can feel that it's good and necessary to reach out for help. Thank you so much for being here today, Amy.
Thank you, Dr. Kat. Thank you for having me.
Absolutely. So we'll just kind of start from the beginning in terms of understanding your postpartum experience. Let us know what that was like for you. What happened?
Okay. First of all, I'd like to say that I had no idea what I was experiencing. I just knew that something wasn't right. I do have two children now and experience different things with each child. But with my first child, the pregnancy was amazing. And just had, the birth plan, had everything planned out. And then once the delivery came, everything just went wrong. And it was a very traumatic delivery. It was completely unexpected. And basically, anything that could have gone wrong did go wrong. My daughter wasn't coming out, and the doctor ended up using forceps. I actually received a 4th-degree laceration with her coming out. And as she came out, she took a deep breath and she swallowed a lot of amniotic fluid and blood. So they were instantly taking her away from me while all this is happening. And I ended up getting an epidural, which I originally did not want. So that for me was also a source of frustration and a little bit of defeat that I thought I could do it without that. Unfortunately, the epidural did not take. And so I went through all of that, completely feeling everything, the tear, the laceration, everything. And in the middle of it was just completely confused because I had this epidural. Why didn't it take? And all this trauma was happening so fast. And then as they took her away to work on her, I heard the doctor whisper to his assistant there, his nurse, that he couldn't get the bleeding to stop. And so my bleeding. And so I was just panicked. I'm laying there and it all happened so fast that I'm wondering what has happened with my daughter and what's happening with me. And now you're telling me that you can't get the bleeding to stop. I'm thinking, oh my gosh, am I going to die? But you hear these stories. And so I'm laying there and I'm just panicked. Well, they whisk her away and he eventually does get the bleeding to stop. And they kept me overnight down in the delivery room because my blood pressure, something went wrong with that. And when they tried to get me up, I kept passing out. And they also at one point came to me and said that my kidneys were failing.
Oh my gosh.
And they couldn't figure out what was happening there. So again, it's like, you've got to be kidding me. I just had an amazing pregnancy and I brought this child into the world. But there was just so much trauma around it that was unexpected. And so they kept me overnight down there. And the next morning when they took me up to my room, another doctor came in to check on me. And she just had this really solemn look on her face when she came in. So I knew something wasn't right. She introduced herself and she said, I'm here to check on you because you are bleeding internally and we cannot figure out why you're losing blood.
Oh,
And if your numbers don't come up, we're going to have to give you a blood transfusion.
oh my
And
gosh.
so, again, for the second day, there's this overwhelming thought of, oh my God, I'm going to die. I can't die. I just brought a baby into this world. And
Right.
so she checked me. They couldn't figure out where the bleeding was coming from, but they started me on iron pills. And thankfully, my numbers started coming up and they didn't have to give me a blood transfusion. But that's how my delivery started out with my first child. And so
Wow.
instead of having that magical moment that you see so much on TV or you dream about,
Hmm.
it was quite the opposite. And
Right.
unfortunately for me, that just led immediately to feelings of, I didn't want this to happen to me. And I can remember looking at my daughter when I would feed her. And just, it felt like
Hmm.
I was looking at a complete stranger. It almost felt like I was babysitting at times. And it
Oh,
actually took me 3 months to bond with her. And
right.
that in itself was really hard as a first time mother because you hear
Hmm.
these stories and the moms are like, oh, it was love at first sight and it was so magical and I felt so complete. And I just
Hmm.
carried such guilt of not understanding why I didn't love this child. Why did I not feel these feelings for her? And
Right.
I didn't dare share that with anyone, not even my husband, because I was too afraid to tell somebody that.
Hmm. Right.
Um, but that's
Absolutely.
kind of how it started out with her. And then, so I was in school full time with her and just hoped that it would help me to, not think about what had happened and that all these feelings were going to come and it was just going to be great. And it just kind of got a little bit worse, not knowing what it was. But, it's kind of one of those things as a parent, you just kind of suck up and say, let's just keep going. And so I just
Right.
kind of pushed it out of my mind, graduated, and then
Amazing.
we just decided, well, maybe that was just the stress of school and having a newborn. So let's just take some time off and everything will get better. And so for a little while, it really did. I started to enjoy my daughter. I started to really bond with her and, was just at that point happy that I had become a mother. So
Right.
enough time passes, you kind of forget how bad things were, in delivery. And so we
Hmm.
decided we'd like to have a second child. And so we were able to get pregnant with our second, which is a little boy. And the pregnancy with him was the complete opposite of my first. It was a very, very
Hmm.
difficult pregnancy. And the doctor actually, I believe, thought that he was going to be a Down's baby. And so that
Hmm.
was a little bit of trauma for us right off the bat, thinking,
Hmm.
wow, that came out of left field. I wasn't expecting that. And so I tried not to dwell on that. I tried to just push that out of my mind. And if he was, he was. And if he wasn't, that was fine as well.
Right.
So we elected to do a cesarean with him because there was just so much trauma and damage with the first baby. And he was
Uh-huh.
expected to be over 10 pounds that we just,
Oh boy.
yes.
Oh,
So I just thought there's no possible way that we can do that. And so we did
right.
schedule a cesarean, which went amazing. And
Hmm.
within 3 days, there with him in the hospital, it was, I completely bonded with him. It was like, wow, this is amazing. This is what it's supposed to be. And I was very grateful to be able to experience that with him.
Hmm.
And
Right.
for the first 6 months, everything was awesome. I mean, there were no problems. I was at home with him. I was happy. I was making his baby food, doing what I thought every mom was supposed to do. And then
Hmm.
around the 6 month mark, things just started kind of falling apart a little bit. I was in constant pain because I had had some
Oh.
complications with my back during the pregnancy. And
Oh.
so during that pain, I wasn't able to like hold him a lot. I wasn't able to carry him,
Hmm.
or, I had a 2 year old. And so
Right.
I wasn't even able to really get down on the floor and play with them. And so slowly things like that started wearing on me and the depression started setting in and then the
Hmm.
anxiety and out of nowhere I didn't even know you could have postpartum OCD. I'd never even heard of
Mhm.
that. But I
Uh-huh.
became so obsessed with germs and so
Okay.
obsessed with cleanliness that I was just convinced. And this even goes back to my first child with the germs. And I didn't know what it was. I just thought I was being a good mom. But
Okay. Yeah.
the obsession with germs and having to have everything clean and boiling everything and washing the clothes and
Hmm.
washing everything,
Hmm.
it became an obsession and I didn't realize it. Um,
Right.
but um, and I can talk a little bit about that later on when I realized that it was a problem. But
Hmm.
still, going back just a little bit, I really still didn't know anything was wrong, but I knew things were progressively getting worse after my second.
Right.
And it got to the point where I just didn't even want to leave the house. The depression got so severe. And there were a lot of other things that had happened during that time that kind of looking back really aided in that deep depression. But
Okay.
it just kind of, it's one of those things where it happened so slowly and progressively that you just didn't see it.
Hmm.
So therefore, it was kind of hard to realize something was that wrong. But I cried all the time, and I just felt so
Oh.
worthless. And
Oh
I
no.
started having intrusive thoughts, and
Hmm.
again, didn't have a clue what those were. I just started thinking, wow, where did that horrible, crazy thought come from? And it scared me. And so I never
Sure.
told anyone about those. I just kept suffering with them and
Right.
had thoughts that bad things were going to happen to the baby or the children or my loved ones. And I started living in a constant state of fear and anxiety.
Hmm.
And then the thoughts about me came of, you're not a good mother, you're an unfit
Oh
mother.
boy.
Your husband would be better off without you. And
Oh
my
no.
husband and I will
Hmm.
be married 16 years this year, and we have a great marriage and have always
Yeah.
had. But I started having these thoughts of, he wouldn't even miss me if I were gone. And
Oh no.
um, someone else could do a better job raising my children. And then at the very end, when it got very, very dark, I started having these just glimpses every now and then, these thoughts that would hit me of, well,
Hmm.
you could just leave, or you could just go do this, or you could just, end it all. And there were
Hmm.
never any concrete plans. It was just these scary thoughts that would come out of nowhere
Hmm.
of, you just
Right.
need to do this. There would be a peaceful resolution for everyone. And
And all at that time, all of that seemed reasonable, or was that
it was
terrifying for
absolutely
you?
horrifying. I mean, I won't
Hmm.
lie to you in the sense that when you have these thoughts, there is like a millisecond of peace to it because then there's an end to all of the nightmare. But then the
Hmm.
very next second, you're like, oh my God, why would I think
Right.
something that horrible? I don't want to do that. I don't want, this
Right.
can't be real.
Right.
And when I knew something was terribly wrong, is we had planned a vacation and we were going to the beach. And we were staying in this resort and we were on the 19th floor. And when we
Hmm.
get up there, we've got everything unpacked. And the next day, I went outside and I was just looking out over the ocean. And this thought came out of nowhere. And it was, if you jumped, it probably wouldn't even hurt because there's sand down there. And I
Wow.
remember just being horrified and thinking, oh my God, I did not just think that. I did not. And I ran
Right.
inside immediately and I shut the doors. And for the next 3 days, I wouldn't even go out on that balcony because I
Oh.
thought, who thinks stuff like that? I was
Hmm.
so scared and I was so afraid. And but still, I wasn't telling anyone, not my best friend,
Right.
not my husband. And my faith plays a big part of who I am. And, I wouldn't even talk to my pastor or his wife or my mentors because I was just
Mm.
too afraid. I thought, if you open your mouth and you say anything, they're immediately going to think you're crazy. They're going to take your children from you and they're going to lock you up somewhere. And so I
Oh.
had all of those feelings that I was keeping inside and just basically drowning, suffocating, and not realizing how to get help or who even to contact. So
Hmm.
when we got back home after that week, I just broke down with my husband in the kitchen and I just started weeping. And I said, you know what? I said, I love you and I love my children. I said, but I want to get in the car and I want to drive as far away from here as I can. And I don't ever
Right.
want to come back. And he
Hmm.
just looked at me and I was crying and he started crying. And I said, I don't know what's
Yeah.
wrong, but something's wrong and I need help. And he said, okay. He said, we're going to do whatever it takes to get you help.
Right.
And excuse me, unfortunately,
Sure.
I didn't have a clue where to turn. I didn't know what
Hmm.
postpartum depression was.
Right.
As
So at this point, you're still, it's been quite some
yes,
time, and there's no idea yet as to what this is, what's actually going on.
no, because to me, it's like my idea of postpartum depression was, a woman who strapped her baby to her chest and jumped off a bridge. I had
Mm.
no idea how common postpartum depression is and
Right.
how treatable it is. And
Hmm.
so he said, well, what do we do? And I said, I don't know. And so the next day, I sat down at my computer and when I pulled up a Google page and I typed in postpartum depression, I kind of just sat there and I laughed at myself, thinking, I can't believe you're doing this. This doesn't even exist. This isn't real. I'm not going to
Hmm.
find anything when I hit enter. But when I did hit enter, I was amazed. I was shocked. I immediately found resources like Postpartum Progress. I found
Hmm.
Postpartum Support International, and then just entry after entry of how real this is and explaining to me.
Yeah.
And as I would read stories like on Postpartum Progress about the moms, it was just like they were writing my story. And I had never
Oh,
told
yeah.
anyone. And then, with Postpartum Support International, there were so many resources on there that just explained it. And
Right.
so I had gone to lunch with a friend of mine,
Hmm.
and she had 4 children. And they were teenagers at this point. And I just thought, you know what? If she's had that many kids and she survived, maybe she could give me some advice.
Right.
And so
Right.
I reluctantly asked her to lunch, and we went. I put her off for a little while because I was still really depressed. I didn't know really what to do.
Right.
And
Right.
so we had lunch and we were laughing and joking. And then toward the end of the lunch, she had mentioned about when she first had her children, how she had moved away from her family and her husband had traveled full time. And so she's a young mom with 2 small children. And
Mm.
so she started telling me her story about how it felt with postpartum depression. And she
Right.
said, I never really had thoughts of wanting to kill myself. She said, but I just wanted to take a bottle of pills and not wake up. And I
Right.
remember sitting there looking at her and thinking, oh my God, you just said what I'm thinking. Maybe that means I'm
Right.
not crazy.
Oh,
And so
right.
it was amazing how that one lunch completely changed my
Mm-hmm.
life. And I never
Mm-hmm.
told her anything. I just sat there and tears just streamed down my face because I was too
Right.
afraid to tell her anything.
Oh,
But from that point forward, I just kept realizing I have to figure out what this is. I guess it's my
right.
personality type, but I just realized if I can better understand this, maybe it won't have such a grip on me.
Right. Absolutely. Wow. So if I can just kind of, for our listeners, for those of you who are listening, this is, a really condensed version of what you went through for a long time.
Yes.
How long do you think this was? Three
At least
years?
3 years
2 years?
because my
3 years.
daughter was 2 when we had my
Hmm.
son. And even though I started feeling better, knowing what I know now, I really wasn't treated. I didn't really, it
Right.
was like basically putting a band aid on a broken arm. I,
Right. Right. Not helpful.
I got some relief, but then life got in the way and I just sort of pushed it
Sure.
out of my mind and then started living with my new normal. You
Right.
start thinking that this is the way it should be. And I never got treatment.
Right. And so what I think is important for people to understand is that for the first thing is that you telling your story, and knowing what you know now, being able to look back and label it as PTSD from the birth and the trauma in birth and the depression, anxiety, and the intrusive OCD thoughts that happened as a result. You were going through this relatively blind. You had no idea what was going on. And so now through you're looking back on it, you can describe what it
Yes.
was. It's so important to know. to have your story here. And I thank you so much for sharing it with us and telling the audience about it. There are so many women who deal with birth trauma and don't get the help that they need. So many women who are traumatized by other experiences that are on the spectrum that may not necessarily be as life threatening as your situation was, but still feel traumatized
Right.
by their birth. And this is a really, really important topic to be addressing and to be asking about. Is if there are any providers listening, this is really something to think about. Unfortunately, sometimes the medical providers, maybe this is something they see relatively often, and think, okay, well, baby's healthy, mom's okay, so everything's fine. But this is the reason that we're doing this episode, this podcast, is to bring light to this thing that happens for women that is essentially behind the scenes. Nobody can see it. But you, for 3 years, were living in this horrible, horrible state of mind that was terrifying to
It
you.
was. And, had I not educated myself,
Mm-hmm.
I don't know today where I would be. But
Right.
I basically just started out self-helping because I didn't know what to do.
Mm-hmm.
At the time, I didn't
Right.
know what an LPC was, a licensed professional counselor. I didn't
Mm-hmm.
know what a psychologist or psychiatrist did. And
Mm-hmm.
so I basically just started reading everything that I could. And I learned that, and I did see a therapist, but I was still too afraid to tell her what was
Right.
happening. So I, in a kind of
Right.
a roundabout way, said, well, I'm having these feelings of anxiety, or I'm having these, feelings. And fortunately for her, she really was able to give me some basic self-help techniques that did work,
Okay.
as
Great.
far as, like, breathing techniques, the breathing in, the holding it, and the exhaling. And I found that
Mm-hmm.
when I was very anxious, that really did help. Um, I also learned how important mommy time is, which I, to this point, had zero. And even just
Mm-hmm.
talking about that with my husband, and us agreeing that, I would just go out for several hours at first, that,
Mm-hmm.
he would take care of the kids, that he would give me a break. And we to this day just call it mommy time. And
Yeah.
my children are now 7 and 5, but I still understand the importance of mommy time and getting
Right.
that alone time, getting that feeling of, this is my life and I'm getting it
Mm-hmm.
back. Because for so
Right.
long, part of it was this, I've lost myself completely. What about
Mm-hmm.
me? What about my dreams? What about my aspirations,
Right.
my career, and what I was
Mm-hmm.
going to do? And I see so many moms who are happy being at home and are happy loving just being a stay at home. And at the time, that just wasn't what I wanted to do. So there was a great
Right.
deal of resentment for me that this was
Mm-hmm.
my lot in life. And
Right.
but getting the help and getting the realization of what it was, I am now just as excited as I can be to have the opportunity to be home with my children. But at the same
Mm-hmm.
time, being an advocate for my community, and helping to educate. I think that was the biggest thing for me. If
Yeah.
someone had just said, look, Amy, this is so common. I need you to know what the symptoms are of postpartum depression and anxiety.
Mm-hmm.
Here's the risk factors. That, I think, would have been
Right.
huge, because
Right.
I had a lot of risk factors and didn't know it. And then
Mm-hmm.
here's the treatment options, and this is how it can
Right.
go about happening. And so
Mm-hmm.
once I started learning about all of that, I realized that that was something that was going to be very important to me.
So through all of the pain and I mean, if I can say suffering that you endured and got through and went through, you've really found a way to use your experience to help other moms and to help other women and to help your community, which is just amazing. And also, that's very often what happens to moms who end up doing volunteer work or advocating, is that they've been through it and realize, oh my gosh, there's not enough help for these moms. And so, if you can you please tell us about what you've been doing in your community and how that's going?
All right, one thing that I started realizing when I started getting stronger. Obviously, you can't be so much of a help when you're in the deep of it, in the thick of it, and you can't breathe
Hmm.
yourself. You can't
Right.
help someone else. But once I started healing and getting stronger and researching, and I decided that this is something that I wanted to do. And I went back to school and started taking a few courses in psychology so that I could eventually at some point get a master's degree and start working specifically in this field.
Right.
But in the meantime, I had the thought that the doctor that sees the moms the most is our pediatrician, and I
Right.
have a great rapport with our pediatrician. And I went to her and I kind of told her what I was thinking and wanting to do. And I asked her if she would be open to utilizing or incorporating, rather, a postpartum assessment program in her practice. And so we
Mm.
sat down and we kind of talked about it. And she said, sure, let's give this a try. So I went back and I started researching what's going to be the most efficient way to do this, because she has
Mhm.
a very busy practice. I can't just expect her to put it on hold for this. And
Mhm.
so in my studies, I found the EPDS, which is the Edinburgh Postnatal Depression Scale. And it's a
Mhm.
quick survey that can be done right in the office, where it's a pretty good indicator of, if a mother is suffering with postpartum depression. And so when I found all these resources, we're still in the process of planning it all out. How is it going to work best in her practice? But the end goal is that all moms with children a year and younger will be assessed at all well visits. That when that mom comes
Fantastic.
in, there's going to be a tracking of how is mom doing? Because if mommy's not
Mhm.
healthy, then baby and family and home aren't going to be in order. And
Right.
so one of the steps also is having therapists to refer the moms to in the need that need arises.
Right.
And so one of the things I've just done is worked with two of the coordinators from my state, from Postpartum Support International. And I organized a workshop where we had therapists come in and get training specifically in perinatal mood and anxiety disorders. And it was
Fantastic.
really exciting. For my first one, 18
Yeah.
therapists signed up and got the training. And so I'm really excited about that.
Oh my gosh. That's 18 therapists and who knows how many clients they'll be seeing, but that's so many more lives being supported in such a more sensitive way.
And it was kind of neat, just sitting there in the training, in the workshop, and listening to the questions that these people were asking. And
Mm.
it's, you don't realize how common this is. You don't realize all the facets that perinatal mood and anxiety disorders really encompass, and
Right.
how common it is, but at the same time how treatable it is.
Yes, and the way that you're able to get into your community and help other people is so powerful. I almost can't even think of a better word. There's so much good in what you're doing, and because you know how important this
I
is,
just wish someone had been there for me and just said, just educated me. And I think it would never have
right?
gotten as bad as it did had I
Yeah.
known that it was possible. I was just so blindsided by it. There was no
Mhm.
education, there was no awareness at all. And so that's really my number one goal, is to bring this out into the light and kind of normalize my
Mhm.
situation, because there is absolutely nothing special about me. I'm very average. And if this happened to me, it's happening so much more. It's just not being talked about. Or a
Right.
mom may not even know what to say because she doesn't know what's happening.
Right. Yes. And that's why sharing your story is so important because the moms who are listening may be able to hear their experience in your experience and know they're not
Yeah.
crazy. I mean, you probably hear that all the time once moms tell you their story is I felt
Yes. And
crazy.
isolated
I
and alone and afraid. And
Yes, yes, and there's help, and this is definitely you mentioned a couple of times, and I think it's so important to emphasize that this is treatable, and it doesn't have to get this bad. It doesn't have to get to this point.
And there's one other thing I did want to add, and this for me was absolutely the hardest part of the whole journey, if I can put it that way, is
Sure.
that the realization hit me that I actually needed medication. And I was
Mm,
very adamant against it. I wanted nothing to do with it. I just thought,
mm,
that's not me. I can do this without it. Um, But there came a point when I realized that, no matter how hard I prayed or how well I ate, how much I exercised, how much mommy time I had, that something was just still not right. And
Mhm.
one day I was in the kitchen and my small son came in and he ran inside and he had this panicked look on his face. And he looked at me and he said, Mommy, Mommy, I was outside and I ate this cookie, but I didn't wash my hands. He said, Mommy, am I going to die? And
Oh,
I remember standing there looking at him and my heart just broke. And I looked and I got down right at his face and I said, No, baby, no, you're not going to die. It's okay that you didn't wash your hands.
mm,
But the realization smacked me in the face that what I was struggling with, I was then pushing down, and my children were absorbing that. And here is
right.
my sweet, precious little son, really terrified that he was going to get some germ and it was going to kill him
Mm.
because he didn't wash his hands. And
Wow.
so I reluctantly started the realization that I needed medication. And
Mm.
I came across Brooke Shields' book, Down Came the Rain.
Yeah.
And that was kind of an eye opening thing for me that maybe it was okay to take medication. Maybe that didn't mean I
Mhm.
was a failure as a mother. And
Mhm.
it was the hardest decision I've ever made because it just was
Yeah.
very difficult for me to come to grips with that. But it was the best decision I've ever made. And it changed my life. It changed everything. And it was just that last little push that I needed with everything else, because for
Yeah.
me, medication alone wouldn't be the answer, but doing
Mhm.
everything else, the self help. CBT was cognitive behavioral therapy was really effective for me.
Mhm.
Understanding your feelings and your thoughts and your actions and how all that works. Um,
Right.
but it just alone wasn't enough, and the medication really was really what I needed. So I would like to
Mhm.
encourage any mom that might have, thoughts that that's not an option, or, you might be
Right.
scared to take it, that it's
Mhm.
not lifelong. It isn't something that you have to take forever. And
Mhm.
there are safe ones, that moms working with your doctors, obviously, can take even if
Mhm.
they're breastfeeding. And some moms may even need that medication while they're pregnant. But
Mhm.
it is something that can be worked with closely with a doctor. And it doesn't mean you're a failure or that you can't do it. It just means that my body just needed that extra boost to help get, my chemicals and everything in balance.
Right. I really, really appreciate you sharing that piece of your journey. In my work, I hear this weekly, moms who are terrified of taking the medication and somehow think that, oh, there's something wrong with them if they need medication. But, at the same time, wouldn't hesitate if they needed to take insulin
Right.
if their kidneys weren't functioning
Exactly.
properly. This your brain is part of your body. This is a whole system that works together, and sometimes absolutely we need that support to help get things in balance again. And addressing the stigma of medication is so important, and I'm really really glad to hear about your experience in that you struggled, and then came to the realization. And everyone's path is
Right.
different, and we can honor everyone's path in that
Mm-hmm.
sense. Maybe medication is necessary, maybe it's
Right.
not, but for you to be supportive and telling our listeners that it's okay and sometimes is necessary,
Yes.
and it doesn't mean you're a bad person.
Right. I mean, because nothing else changed. I mean, I went about doing everything the same, but my husband started noticing, and I started noticing, and just the anxiety and the constantness of it, if I can say that without really knowing
Mhm.
how to explain it. It because my main concern was I didn't want to walk around and feel drugged. I didn't want to feel like I was
Right.
in a fog. And it was
Mhm.
literally like, and someone used this analogy and it's perfect. If you wear glasses and the first time you put them on, everything became so clear and crisp. And when you take them, when you're not used to them, you don't realize how dull everything is. But there's just
Uh-huh.
this sharpness that came about everything. And it was
Mhm.
just like, wow, I really regretted not doing it sooner.
I think that's another good point is a lot of people do hesitate when maybe their symptoms are in the severe range and their quality of life is being compromised, to try medication. And to your point, it's not necessarily certainly a lifelong thing. And for some people, depending on what's going on for them and their history, it could
Right.
be, but not necessarily. That's really important to address that this is time limited,
Yes.
but sometimes very necessary.
Yes. At least for me, it was.
Right. Absolutely. Amy, I'm so grateful, and I hope that our listeners understand what it means for you to have shared your story. Within maternal mental health, within mental health in general, talking about what we deal with is already as difficult, and then certainly the additional layer of stigma and pressure to be this perfect mom and to have everything just so and feeling great and wonderful and all these myths that we subscribe to. The reality is often quite different, and it is powerful for you to be sharing your story so that a mom out there somewhere can know that she's not alone. And I thank you so much for taking the time and being open with us
Well,
today.
thank you so much for giving me this opportunity.
By joining us today and listening, you're a part of the growing community of people who are aware and concerned for mothers and families during this beautiful and sometimes very difficult time of life. Please take a moment to subscribe, rate, and review this free podcast so that Mom and Mind can be found by moms, families, and providers who will benefit from hearing our talks. If you or someone you know is having a hard time, help is available. Please look for resources for help at momandmind.com, where you will also find links and information from today's episode. Thank you for listening and being a part of the Mom and Mind community.